Indiana Newsdesk is made possible in part by Smithville Fiber Internet, streaming TV, home security and automation in Southern Indiana. More information at smithville.com. MALLOR GRODNER Attorneys providing legal services to clients and the community. Understanding, expertise, results. Bloomington and Indianapolis. LawMG.com. IU Alumni Association connecting IU's network of alumni and sharing the Indiana spirit through scholarships, advocacy, and volunteerism. Alumni.iu.edu. IU Center for Rural Engagement extending IU Bloomington resources to improve Hoosier lives in partnership with communities and organizations. Rural.indiana.edu. And by WTIU members. Thank you.
Coming up on Indiana Newsdesk. We know about half of Indiana's COVID deaths are among residents of nursing homes and long-term care facilities. But the state has resisted calls to release complete information about COVID cases and deaths in these facilities.
What the real interest is here is making sure that the data itself have integrity and make sure that it's useful and meaningful for individuals in the government to have.
Ahead, we ask the state why data is being kept private. Many families are delaying their kids' vaccinations during the pandemic.
They're trying to keep their family safe.
Coming up, health experts weigh the risks of skipping vaccinations compared to the possibility of contracting COVID-19. Plus, a major Supreme Court victory for LGBTQ rights this week will impact Indiana. How the decision could affect the Religious Freedom Restoration Law and a couple of high-profile cases against the archdiocese in Indianapolis. Those stories and more right now on Indiana Newsdesk. Welcome to Indiana Newsdesk. I'm Joe Wren. The spread of COVID-19 seems to be slowing down in Indiana, but health officials say that doesn't mean it's time to sound the all clear. The Fairbanks School of Public Health at IUPUI released new numbers this week in a statewide study of the virus. In the Fairbanks study's first round of testing in late April, the number of people who actively had the virus was more than the number who previously contracted it, providing a sort of baseline for the spread of the disease. The latest results show a slowdown in that spread.
Because as of the first week of June, we had more people previously infected than those that were currently infected at that time.
Mina Kemi, though, adds a note of caution.
While we might have good news today that we are managing well, it's not an opportunity to sort of relax everything we've been doing to get us to this point.
43% of those who tested actively positive for COVID-19 didn't show any symptoms at that time. That's pretty much the same from the study's first round. Statewide, almost 42,000 people in Indiana have tested positive for the new coronavirus, and more than 2,300 have died from COVID-19. Across the country, people have been putting off regular doctor's appointments because of the coronavirus. That's an issue for children's wellness visits because it means in a lot of cases their vaccinations are being delayed. Numbers from the CDC show vaccination rates have fallen by as much as 40% in some places. As Mitch Legan reports, doctors are hoping to catch kids up before flu season starts in the fall.
Abby Bone had enough on her plate, trying to balance her job as an attorney with her role as a new mother. Then a global pandemic hit.
Parenting in general is hard just because every step is just constant, paranoia. But then when you throw in this pandemic, especially with all the unknowns, it's super scary.
Now she has a decision to make. Her son Teddy's vaccination schedule has him set to go to the doctors next week for shots. But with everything surrounding COVID-19, she's not sure if it's a good idea.
I think every day and week we're learning things about the pandemic, and so if next week things start to clear up and we see a significant downfall, and then maybe. But right now I don't think there are a ton of things that's worth the risk for me.
Since the coronavirus pandemic hit the U.S., parents across the state and country have found themselves in the same situation as Bone. According to the Centers for Disease Control and Prevention, vaccine orders plummeted after President Donald Trump declared a national emergency on March 13th.
In general, across the country, many of the vaccines have gone down by 50 to 70%. So I don't know that we have exact numbers for our Bloomington area practices right now, but we certainly know that we have vaccinated fewer kids.
In 2019, Monroe County had a vaccination rate of about 83%, which put it near the top of the state. So what could be keeping parents from the pediatrician's office?
I think people are scared and they're trying to navigate, again, sort of keeping their families safe, and they may not see preventive behaviors as the most important thing to focus on when we're facing a global pandemic.
In Indiana, the numbers show a similar story. In the month of April alone, the number of non-flu vaccinations ordered for children 18 and under fell by more than 93,000 doses, nearly a 47% decrease compared to last April. The State Department of Health is still evaluating data from January to May of this year, but those in healthcare say those numbers are only now starting to creep back up.
I mean, hopefully we're in a position right now where we can get people caught up and keep our high vaccination coverage so that we can, not worry so much about these highly communicable illnesses.
That's a concern for health professionals throughout Indiana, which already ranks near the bottom of the country in vaccination rates.
We really would be heartbroken to lose children over vaccine preventable diseases in the middle of a pandemic. So we're really focusing on that right now. We're working with the Indiana Immunization Coalition, and as I mentioned, our local health departments that also give a large bulk of our immunizations.
The good news is that for children younger than 2 like Teddy, drops in vaccinations haven't been as steep since health providers have been prioritizing them. But the challenge for providers now is convincing those parents that the risks of skipping vaccinations for things like diphtheria and whooping cough outweigh the possibility of contracting COVID-19.
I think a lot of parents in particular are delaying those well-child visits or delaying vaccines because they're trying to keep their family safe. And I think what we would say is that this is another really important way to keep them safe.
In an attempt to ease concerns, the Greene County Hospital Foundation has separated its rural health clinics so that those who are feeling healthy get sent to the blue clinics, like the one in Bloomfield. People with respiratory symptoms get sent to the yellow clinic in Linton, while those with COVID-19 are sent to the general hospital there.
Before we let anybody come into the blue clinic, they're screened for COVID symptoms, and there are some other questions we ask just to keep sick patients separate from well patients.
Everyone at the Greene County clinics is required to wear masks, and only one parent is allowed in the building with their child. Plus, Head says many pediatricians' offices are purposefully separated from the rest of a hospital, meaning parents won't necessarily be walking into an ER or an ICU.
It is a scary time, and it's important to acknowledge that there's uncertainty around sort of everything happening right now. But there is not uncertainty around the safety and effectiveness of the vaccines that we have.
And in addition to vaccines' public health importance, skipping appointments could impact how schools reopen. Having a crop of kids who aren't up to date on their shots would make planning the upcoming school year even more difficult than it already has been. Dr. Moore says now he and pediatricians across the state are focused on tracking down the kids whose vaccinations have been delayed and getting them back into the office in preparation for whatever this fall brings. For Indiana Newsdesk, I'm Mitch Legan.
Long-term care facilities have been disproportionately impacted by COVID-19. However, the extent to which facilities have been hit is largely unclear. My colleague Brock Turner has been following the story and is here with more. Hi, Brock. So just to start off, could you paint us a picture? What's going on and why should folks be paying attention?
Yeah, Joe. So even if you don't have a family member or relative in a long-term care facility, this has an impact. An order from April required long-term care facilities to report confirmed and suspected cases and deaths of facility employees and residents to the state's health department. The federal government also required Medicaid-certified facilities to report that federally. The problem is numbers from the two sources don't always match up, and pretty much everyone recognizes the data that we are collecting is flawed.
So what do the numbers, even though they might not be fully accurate, tell us? Are there locations where certain facilities have been affected more than others?
Yeah, so we do have an idea, but we don't know for sure. Publicly, Indiana only releases the aggregate number of facilities with a COVID-19 case or death. So we know that there are 264 facilities with a confirmed COVID-19 case, and 164 of those have at least experienced one death. Altogether, we do know that more than 1,000 Hoosiers living in nursing homes have died of coronavirus, and nearly 5,000 have been infected. However, that's all the states reporting federally.
So, Brock, what are other states doing and are releasing and collecting? How do other states compare to us?
Yeah, so in the Midwest, Indiana really kind of is alone here. All of our neighbors are providing some type of long-term facility care level data. Many Indiana counties are analyzing that data themselves to inform local decisions. However, some have opted to make that public. Around half of the health departments around a half dozen of the health departments I spoke with said that the State Department of Health told them not to release that data at all. That is something that the state denies, though. We do know, however, that earlier this month, ISDH provided talking points for health departments not releasing data during a webinar.
If you are asked why you aren't receiving facility-specific information, you can reference that you are following the communication guidelines for long-term care facilities located on the link at the slide.
So, Joe, even if the state isn't strictly forbidding local health departments from releasing data, they're not really encouraging much transparency.
And the state says they're protecting patient privacy and that conversation should occur between facilities and families. What are people saying about this decision? Is this information available for caregivers?
Well, most caregivers say they are getting this information, but we know that's not always the case. The state set up an email for folks not receiving information, and we know that there have been at least 22 complaints filed. But the state declined to say if those complaints were resolved, only that they had been followed up and received. Advocates from AARP Indiana have been public about their desire to have this information released, especially for people who might be searching for a long-term care facility. Health experts say they have little incentive to do so, though. Additionally, Joe, the presence of COVID-19 in a facility is not really representative of the care residents are receiving or will receive there.
We have seen buildings that are 5-star buildings have had outstanding records that have been devastated, frankly, by the virus, and have had a large number of cases and have had people pass away, even have had staff members who have contracted the virus and passed away. And it's unbelievably heartbreaking. The regulatory record, past regulatory records really don't have a bearing on what that virus is capable of doing and where it's going to reside.
All right, Brock, thanks for walking us through this.
Absolutely, Joe. Thanks for having me.
Well, the state's K-12 public schools won't face funding cuts for the 2020-2021 school year. Instead, the state will move forward with the current budget, which includes a $183 million increase for K-12 spending for schools. This increase will be awarded regardless of whether students are attending class in person or online due to restrictions imposed due to the coronavirus pandemic.
We did not want to limit resources, as school corporations must prepare and execute a productive and safe learning environment.
State guidance encourages schools to enhance virtual learning options if parents decide to keep their kids home from school, or in case of a new surge of COVID-19 outbreaks, cause some schools to close again in the fall. Republican budget writers and the governor say they support the idea of fully funding students learning virtually during the pandemic and would back legislative action to do so. Public universities and state agencies still face significant budget cuts for the fiscal year starting July 1st. The state has asked its agencies to cut 15% of their budgets, and higher education institutions will get a 7% cut. Together, those cuts could reach about $1 billion. Indiana fiscal officials expect the state to fall between $3 to $4 billion short of its current two-year state budget. Well, you may have found yourself cooking a lot more during the stay-at-home order, and chances are you probably paid a bit more for the groceries you bought during that time. As Adam Pinsker reports, food prices increased by 4% in the month of May.
The Indiana Farm Bureau says the big issue with food prices increasing isn't a lack of food supply, it is a logistics problem. A sudden shift in demand during the coronavirus quarantine caught many suppliers off guard.
70% of our bacon was consumed through restaurants.
The Farm Bureau's Randy Crone says with restaurants and institutions shuttered, no one was using all that bulk meat, which would explain why beef prices skyrocketed at the grocery store.
All of a sudden, the packing plants had to package it different, and they were not prepared to be doing that to ship to grocery stores and not through restaurants.
To make matters worse, cases of COVID-19 in Cass County spiked, causing the Tyson meatpacking plant in Logansport to close for 2 weeks. It's not just meat. Dairy and egg prices also increased in May.
We actually had to switch our egg supplier just because the cost was outrageous.
Jonathan Lawler owns Healthy Harvest Market in Indianapolis. He says he tried to do his best not to pass price increases down to his customers, many of whom were on fixed incomes.
But I think panic drove up the cost of eggs, and that's what's kind of upsetting is American egg producers can produce so many eggs that, eggs should be some of the most affordable protein available to people.
Crone says processing plants should be applauded for quickly pivoting from serving the food service industry to serving grocery stores.
This was a huge learning lesson for all of us, and I give credit. Everybody's pretty innovative and tried to adjust as quickly as possible, but it just takes time.
The Indiana Farm Bureau anticipates food prices dropping now that restaurants, schools, and institutions are slowly reopening. For Indiana Newsdesk, I'm Adam Pinsker.
The silver lining of this is, of course, that even though people are paying more at the grocery store, they are also eating out less because of the virus. So that means overall a lot of families are actually saving money because they're cooking more at home. Coming up next on Indiana Newsdesk. This week's Supreme Court decision protects LGBTQ workers for discrimination. But in practice, will it really mean much of a difference for Hoosiers? A legal expert responds coming up. And there are renewed calls to return operation of the Bloomington Farmers Market over to the vendors. These stories and more right here on Indiana Newsdesk.
The WTIU WFIU news team connects Indiana to the world. We bring you the top news of the day on radio, TV, and online. We round up the stories that have people talking each week and dig deep into the issues that affect your community the most. The WTIU WFIU news team is where you are and telling your story.
In a time of change, where can you find in-depth reporting and thoughtful analysis? Washington Week on PBS. Join moderator Robert Costa.
When I was at the Capitol this week, I encountered the same.
And a panel of award-winning journalists.
You're seeing a divided nation, and you're seeing.
For insights and perspective.
Tonight there was a key development in the
Senate. You won't find anywhere else.
What a week.
Washington Week.
Welcome back to Indiana Newsdesk. A Supreme Court decision this week expands workplace equity for LGBTQ employees. Many Americans already believe that federal law protected lesbians, gay men, and transgender people from being fired or otherwise discriminated against at work. But that wasn't the case. Deborah Whitus from Indiana University's MALLOR School of Law joins us now. Deborah, this ruling, a major victory for LGBTQ human rights. Can you just explain the importance of this decision?
Well, yes. I mean, as you said, it really wasn't clear under federal law that people were protected from discrimination on the basis of their sexual orientation or their gender identity. There were state laws that did that in some states, but not in others. And so this just makes really clear that anywhere in the country, you're protected by our civil rights laws now.
If a lot of people already believe the Civil Rights Act protected LGBTQ, so will we see a lot of change with this new ruling?
I think we will. I mean, I think that now that it's clear and it's been decided by the Supreme Court, it feels safe for people to start to be more comfortable disclosing at work, coming out, bringing a same-sex spouse to a company event, being open about the idea of transitioning gender. I think that we'll see more employees being comfortable sharing these key parts of their identity.
I wanted to ask about things that this ruling does not do. One of the first questions that comes to mind is whether employers can fire an LGBTQ person for religious reasons. Now in Indiana, of course, you remember 2 former school guidance counselors filed complaints against Roncalli High School, as well as the Roman Catholic Archdiocese of Indianapolis. Does this decision impact any of those cases?
What this decision does is make clear that that's an open question. There are some special rules that can apply to religious employers when it comes to making decisions about employees who play a ministerial role. And so one key question is going to be how big that scope it is. Is we know that a teacher who's sort of an ordained minister too and is teaching religion all day long, that can be considered a ministerial role. But it's not clear if somebody like a guidance counselor or say someone working at a soup kitchen who says grace before serving a meal, is that enough to make someone a minister and sort of fall within this exception?
You know, this decision also doesn't apply to workplaces with fewer than 15 people. Are there other workplace equal rights issues that aren't addressed in this ruling?
Well, with the smaller workplaces, so in Indiana, for example, our civil rights law covers employers that are smaller, so anyone who has at least 6 employees. And our civil rights law, like the federal law, prohibits discrimination on the basis of sex. And so what the Supreme Court decision did is it explained that if you discriminate against someone because of their sexual orientation or their gender identity, you're necessarily discriminating against them on the basis of sex, because essentially, if it's a woman married to a woman, she's being treated differently than a man married to a woman would be. And so what I think you'll start to see is states reinterpreting or taking a close look at their own state laws and following the reasoning of the Supreme Court. So I think in Indiana, for example, you know, I don't know for sure, but I think it's likely that we would reinterpret our state law similarly.
All right, Deborah, thank you very much. Appreciate your time.
Thank you. Nice to see you again.
Well, attorneys for 4 men on federal death row are now working at an accelerated pace to save their lives after the Justice Department set execution dates for later this summer. Adam Pinsker tells us why one of the attorneys claims the government is violating its own policy on executions.
The United States Penitentiary in Terre Haute will be the site of 3 executions in 5 days when Daniel Lee is put to death by lethal injection on July 13th, followed by Wesley Perkey July 15th and Dustin Honkin July 17th. A 4th man, Keith Nelson, will be put to death August 28th.
I've been doing death penalty work for 30 years, and I've never had a case where the lead prosecutor in the case, the judge who presided, and the family of the victims did not want to see this execution go forward.
Ruth Friedman represents Lee, who was convicted in 1999 of killing Bill Mueller, his wife Nancy, and daughter Sarah in Arkansas. But Nancy's mother, Earlene Peterson, doesn't want Lee executed.
I can't see how executing Daniel Lee will honor my daughter in any way. In fact, kind of like it dirties her name.
The 3 other men were also sent to death row after being convicted of murdering and sexually assaulting children. Last December, a judge stayed the executions of Lee, Perkey, Honkin, and another man, Alfred Borges, because the federal government planned to use a single drug to execute them. A 1994 law says the federal government must use the same method of execution performed by the state in which that execution is taking place. Indiana uses a 3-drug cocktail, but in April, the condemned men's challenge was rejected by a D.C. appeals court. Execution dates were set by Attorney General Bill Barr before the case reached the Supreme Court.
It's still up at the Supreme Court, and the Supreme Court could decide to review it, but it's now on a very truncated, rushed schedule, which is not what the Supreme Court does.
But in a statement released earlier this week, Attorney General Barr said the American people, acting through Congress and presidents of both political parties, have long instructed that defendants convicted of the most heinous crimes should be subject to a sentence of death. The 4 murderers whose executions are scheduled have received full and fair proceedings under our Constitution and laws. We owe it to the victims of these horrific crimes and to the families left behind to carry the sentence imposed by our justice system. Peterson is appealing to the Attorney General's boss, President Trump, to halt the executions himself.
If I could talk personally to President Trump, I feel he could feel my heart and know that I don't want this to happen.
For Indiana Newsdesk, I'm Adam Pinsker.
The Bloomington Farmers Market is facing new criticism about whether it's an inclusive place for everyone in the community. The Broadening Inclusion Subcommittee of the market recently issued a controversial statement on Facebook about black-on-black crime. As Ethan Burks reports, some activists say it's time for vendors to take over control of the market.
After posting that comment on Facebook, the Farmers Market Advisory Council called a meeting this week and voted to disband the Broadening Inclusion Subcommittee. The council oversees that subcommittee and is under the umbrella of the city's Parks Department. Parks Department Director Paula McDevitt apologized for the department's insensitivity.
The last thing we wanted to do was to add to the pain so many people in our community have and continue to experience.
The Broadening and Inclusion Subcommittee was formed last November to help deal with racial incidents that have occurred at the Bloomington Farmers Market. Last year, controversy erupted after news surfaced that vendor Sarah Dye from Schooner Creek Farm had ties to a white supremacist group. Several members of the public say that there will never be inclusion at the farmers market as long as Schooner Creek is allowed to operate there.
No person of color, no Black person, no disabled person, no person who is a member of a religious minority can feel safe in that space.
Leader of Black Lives Matter Bloomington, Jada B., says the Farmers Market Council isn't capable of fairly representing the community's interests.
Every single one of you should resign, disband, and turn the market over to the vendors who are more capable of deciding what is happening.
Several community members say they will boycott the market until the city bans Schooner Creek Farm. For Indiana Newsdesk, I'm Ethan Burks.
That's the end of this program, but our work continues online as we cover the news throughout the week at WTIUnews.org. Have a great weekend.
Indiana Newsdesk is made possible in part by Smithville Fiber Internet, streaming TV, home security and automation in Southern Indiana. More information at smithville.com. MALLOR GRODNER attorneys providing legal services to clients and the community. Understanding, expertise, results. Bloomington and Indianapolis. LawMG.com. IU Alumni Association connecting IU's network of alumni and sharing the Indiana spirit through scholarships, advocacy, and volunteerism. Alumni.iu.edu. IU Center for Rural Engagement extending IU Bloomington resources to improve Hoosier lives in partnership with communities and organizations. Rural.indiana.edu. And by WTIU members. Thank you.